continue to work through this global pandemic. And again, I think everyone's coming to that consensus where when this started, as you would recall, way back in February, when I remember making some of the first plans, and the city was very proactive back in February, ordering Aeroclear, sterilizers, and pieces of equipment that most of it had never really thought would ever be used outside of a contaminated scene on a fire emergency or a, other type of emergency. We thought, okay, here's an outline, here's a plan for uncharted territory, and we had assumed by this time things might be getting back to some sense of normal. We were hoping we'd hear more developments on vaccines. We were hoping we'd have more case history to prove, what we did, how this virus spreads, the infection rates and the death tolls. And while we have some of that information, I think, again, what it's informing us is that we're preparing for the long haul. And so I know as a city, we continue to prepare that way. We continue to manage resources for the long haul and try to make our plans for daily operations and serving our citizens, keeping in mind the long haul. We're very fortunate that Jerry reported to us yesterday that the entire fire staff is at work and healthy. We do have some other employees out in other critical areas of the city who are either under watch or dealing with family members who have infections. But as we talk about the long haul today, we're joined by a few guests. We have Bob Snyder. I almost called you Bob Bickle. Bob Snyder. You guys are, such in tandem, you and Dr. Bickle. Bob Snyder with the Flagler County and the State Department of Health here in Flagler County. Of course, Dr. Bickle, our medical director. Wally Aquino from Advent Health should be on the line. Of course, Chief Forte and myself, Matt Morton, city manager. So as we prepare for the long haul, I'd like to open with you, Bob, and give us kind of where we're at with our case numbers and our rates and what health is doing to help us get in that mindset of the long haul, being prepared and staying vigilant as we see out this pandemic.
Be glad to, Matt. Good afternoon, Palm Coast and Flagler County. Since the beginning of the pandemic, we began tracking 10 indicators to gauge the spread of the virus here in Flagler County and Palm Coast. Total positive cases in Flagler this morning was 976. This compares to 383 positive cases just 4 weeks ago. Of the 976 for the county, 707 are from Palm Coast zip codes. Deaths related to COVID total 13 for Flagler County. The positivity rate for new cases the last 14 days is 7.3%, and it's pretty much stayed that way, Matt, for the last 10 days or so. But this compares to 1% positivity rate a few weeks ago. Hospitalizations related to the virus was 14 yesterday, which is lower than last week, so some stabilization there. The workload for public health nurses and disease investigators remains high. Just 4 or 5 weeks ago, we were involved with 100 positive cases and tracing calls per day, and as of right now, it's about 400 per day. However, 2 indicators are still trending in the right direction. Emergency room visits for COVID-19-like symptoms began a downward trend on the week of July 12th, and that has been sustained. And the RT value, which is the reproduction rate of the virus from an infectious person to another, is less than 1.0. It is now 0.97. The lower the better for decreasing transmission. A new report made public by the Department of Health on July 31st is the number of children testing positive for COVID-19 by county. For Flagler, 77 children who are 18 years or younger have tested positive. This reflects a positive case rate of 11.5%, which is less than the state average of 15%. As with all the 67 county health departments, the public health strategy is still focused on testing, tracing, isolating, and monitoring for hotspot areas, including nursing homes and other congregate care facilities. We are fortunate to not have a major outbreak in any of our long-term care facilities. However, we do have one outbreak in a small group home. All the folks involved are in quarantine. Their close contacts have been identified and tested, and infection control nurse specialists are providing guidance to the owner. Community testing has expanded in the last month. 13.3% of our county's residents have been tested. Next week, the health department will conduct testing at Cattleman's Hall. We began that a couple of weeks ago. That's Cattleman's Hall at the fairgrounds, and we're going to test 4 days a week there, Monday through Thursday, from 9 a.m. to noon. And this is the only site requiring an appointment. So if you want an appointment to arrange a time to be tested, please call 386-313-4200. The health department also has established 5 additional testing sites that don't require an appointment, and each can accommodate up to 60 people per day. These are drive-through testing sites, similar, Matt, to what we had at Daytona State College. So these sites are Santa Maria del Mar Catholic Church. We'll be testing there each Monday from 4 to 6 p.m. The First United Methodist Church in Bunnell on Wednesdays from 4:30 to 6 p.m. The Flagler Beach Pharmacy on Thursdays from 9 to 10:30 a.m. Mother Ann Seton Catholic Church every Friday in the morning from 9:30 to 11 a.m. and Church on the Rock in Bunnell every Saturday from 9 to 11 a.m. We are very grateful to all of these organizations and churches for their support. Each site is operational on a separate day with various testing times for attracting as many residents as possible. So, case investigation, contact tracing, and making hundreds of phone calls per day remain our priorities. I mentioned last week how we have received CARES Act funding to hire up to 40 additional staff to keep up with these core disease investigation tasks. So far, 22 new health department staff have been trained and are on board. Finally, everyone, we have more masks to distribute. We have given out 155,000 to date and just received another 67,000 last week. So if you or your organization need cloth facial coverings that are made of soft cotton and can be washed, please call Gretchen Smith, our communications manager, at 386-276-1168, and we'll set you up. So, finally, and without further ado, Dr. Stephen Bickle, our medical director, will now kick off our theme for today, which is, as Matt said, preparing for the long haul. Take it away, Dr. Bickle.
Okay, well, I think that, I think a lot of us were hoping that we weren't going to be at this place, that preparing for the long haul, that it was going to be a short haul, and that we'd have a wave and then kind of get through it and it would kind of go away like the flu. Well, it's kind of obvious to everybody now that that's not the case. We actually did pretty well in our county with numbers like, 1 or 2 cases a day on average for most of April and May. And then just out of the blue, when it started picking up in Florida, we just got slammed and our caseload went up over, 10 to even 15 times as much, just kind of out of the blue. So it's obvious this is a tough illness. It's very contagious. And, we're going to be in this situation for a while, and we have to adapt to it and try to, come up with the best ways we can to control it without paralyzing, our economy and our lives. So with that in mind, I'm going to talk about 5 basic areas that relate to this topic of preparing for the long haul. And they're areas of focus for us. The first one is controlling cases. Second is monitoring. Third is improving treatment of patients with illness. Fourth are policy changes that may come up. And fifth is hope for the future. So in terms of controlling cases, we talked about this last week. key to this is keeping the reproductive number down. That's the number that sort of reflects how this disease is spreading in the community. We talked about exponential growth, that this thing can not just grow in kind of a linear fashion, but can actually double, in a fairly short number of days, very small number of days if we don't contain it. So the numbers can go up dramatically very quickly. And so that number is represented by this R, or reproductive number. If we get it under 1, which has sort of happened in Florida in the last few weeks, then the numbers stop going up. Doesn't mean they go away, they stop going up. And if we get it way under 1, then they start going down at a significant rate. And the way we do that is by a combination of things. First is population measures, includes mask wearing, the more the better. We have people still not on board with this. The more people that do it, the more impact it's going to have. And it's a protective thing for others and also for yourselves. Also following social distancing practices. I think we're all pretty familiar with that, the 6 feet limit, and then hygiene and hand washing. And then also what's something very important is COVID safe business practices, businesses kind of reinforcing these habits and procedures. A second thing's kind of related to that is fighting COVID, what I call COVID fatigue, minimization, and denial. And this is a real challenge. There are people who don't know anybody who's had this. I personally know of 3 people who died from this. So this has certainly gotten my attention. These aren't close friends of mine, but they're friends of mine. So others don't know anybody who's even had this, but you can look at the statistics. They're not made up, even though some people think they are. There's reporting all over the country and the states and locally. We're testing, or there's databases. And we also know that the caseload the cases go up in one time period, and then 20 to 30 days later, the deaths go up. And in between that, the hospitalizations go up. And that's happened in Flagler County. We used to have just 1 or 2 patients in the hospital, sometimes 3 or 4 in April and May. And June and July, it's been like 10 to 20. I think even over 20 a couple times. And we've had, a number more of deaths in the last month or 2. So it just happens with the lag. You may not know somebody who's had it, but there's a lot of it out there. Their estimates are that there are probably 10 times as many cases as we've actually picked up in any region on average. So Flagler has not quite 1,000, but estimates are that we may actually have as many as 5,000 or 10,000 of actual people who've been infected. They just haven't been diagnosed. And related to our fight against these cases is testing people, contact tracing, limiting the spread, getting people to isolate themselves once they turn positive. This has been a real challenge because as the caseload gets higher, the contacts of the cases get higher and higher. And as Bob Snyder talked about, it's a real challenge. It's a real challenge to track all these people. And then that's been complicated by the delays in getting test results. So we can't do this in as timely fashion as possible, but it's being worked on. So a lot of effort going into trying to make that more available. Then the last item in controlling cases is protecting our vulnerable population as much as possible. And there's been a very concerted effort throughout Florida, and especially in our own county, spearheaded by the health department, and which is to do surveillance of the nursing homes on a regular basis. Unfortunately, we've been lucky in that area. The second thing is to kind of, in terms of monitoring, is we need to have an ongoing ability to track and assess how we're doing and make adjustments. So related to that, we look at daily and weekly case counts, make sure our testing rates are adequate, because if we're not testing enough, we're going to be missing cases just because the people aren't getting the tests done. There's a new program that our city is one of a relatively small number in the country that's starting wastewater surveillance that's measuring the viral loads in wastewater, which is a way of tracking the trends. And it kind of is something we use to look at, in comparison with other statistics. Sometimes it's a little more sensitive. Sometimes it indicates activity in an area where we haven't found cases yet. So it's just one other data point that we can use to take on, more testing and more surveillance and more case containment. And the other areas we're looking at are emergency room visits, hospitalizations, and then, like I said, vulnerable populations, surveillance there, and also identifying hotspots and testing them and trying to focus containment strategies on those areas. The third area I'd like to talk about is treatment. This is an area that hasn't gotten a lot of attention outside of medical circles, but at least part of the reason, in fact, probably a significant part of the reason that the death rates haven't been as bad the last couple months. Partly it's a younger population, less vulnerable, but partly it's that medical treatment has gotten significantly better. Our hospitals, they learn as they gain experience. We have experienced medical personnel now who've dealt with this for a few months. They've learned what works, what doesn't work. There's a couple treatments. There's an antiviral treatment, remdesivir, that's moderately effective. Also an anti-inflammatory treatment, dexamethasone, for selected very sick patients. There are better strategies for managing patients on ventilators, avoiding ventilation when possible. There's also medications to treat the coagulation or blood clotting disorders that can happen with this disease, and just a better understanding of how to do surveillance for the inflammation that comes with it. So I think it's hard to come up with exact numbers, but I definitely think that's impacted the death rate, and sick people are surviving with this much more than they did at the beginning. The fourth, and that's important. That's one of the main things we worry about with this illness is mortality. The fourth area is policy changes. This is going to be something where it's going to be a constant, area of flux, where we're going to be looking, our leaders are going to be focusing on us. They're going to be getting input from the medical people. Our schools are now, looking at opening, and all these things influence each other. Business initiatives to keep our businesses open but keep the spread down. Things are going to be shifting. That we've been emphasizing masks because they don't disrupt economic activity like other things do. We've been emphasizing testing because it's something the health department can do and then focus their efforts on containing people and leave others to continue their daily activities. So we're constantly trying to balance the social containment strategies, social distancing measures to open them as much as possible, but not let this disease get out of control. So it's going to be shifting depending on how we're doing. And that's something that we can just expect will be ongoing for another several months, maybe a year or more. And that, illustrate that is the issue of opening the schools. I think many experts, in fact, virtually all of them, agree that there's some real negative consequences to keeping schools closed. Children are at vulnerable periods in their lives. The learning, and especially in early ages, is something where you just don't want to deprive them of that. Can be long-term consequences of inadequate socialization and inadequate learning at these formative stages. So there's a real downside to keeping the schools closed to prevent infection. So we're going to be opening them up, but there's been cases of schools opening, spreading into the population, and we obviously want to limit that. So that's something where there's going to be an ongoing kind of policy assessment and maybe some changes over time. And the last area I want to talk about is, is there anything we can look forward to here besides just, a long battle with this? And I think there are a couple things. A lot of you have heard about vaccines. It's still a real wild card. There's an incredible effort being put forth to get a vaccine and to get it quickly. There's all over the world, there are top flight scientists looking at this, but it's a real unknown. It's you never quite know what vaccines are going to come through, if they're going to work partially or completely. There's many illnesses, infectious illnesses, where there never have been vaccines developed despite a lot of effort. So there's hope for this. There's a lot of optimism. A lot of experts in the field think that we've made substantial progress, and a lot of the molecular biology advancements that have happened in the last decade will continue to contribute to this, and that we're really going to have one or more vaccines available by the end of the year or early next year. And that's something we can hope for. We'll never really know until it happens. But there's one other thing that has come up in the last month that's gaining some traction and actually could be a really significant advance. And that is the technology has been developed to create very inexpensive rapid tests for COVID that could be used on a widespread basis. They're still working through the details. The FDA hasn't approved any of these super rapid, cheap tests yet. There's a couple rapid tests that are used, but they're only about halfway there in terms of what we want. What we'd want is something like just paper strips that people could test themselves like a home test. And if that happens, it could dramatically change how we approach this, because we could test large populations multiple times a week, actually, and find cases in the very early stages before they spread, which has been the big limiting factor with this illness. At least half of the spread with this happens before people are symptomatic, don't even know they have it. They haven't been tested, so we don't find them until they've already spread it to other people, and then we try to contain that, but there's already another group incubating this, and that's been the ongoing challenge. So those two things are things that we're looking forward to seeing some real breakthroughs, and we've got to just do everything we can possible until we get there to contain this, and hopefully we can really drive these numbers down in the next month or two, even before we get some of these major breakthrough measures in place.
Excellent. Appreciate it. Thank you, Dr. Bickle. Also, we appreciate all of our medical community across the county. I know across the state, as our medical community, our first responders on the front lines of hospitals and clinics and testing sites, all those volunteers continue to work. And we do have Wally D'Aquino here today from Advent Health as one of our partners in this COVID-19 long haul, preparing for the long haul. And Wally, I was hoping you could give us the Advent Health update and also discuss your strategies fitting in today's theme of how you guys continue to staff, plan, and prepare for the long haul of this event.
Yes, Matt, thank you, and good afternoon, everyone. As reported earlier, the hospital has finally experienced some decrease in the hospitalization for COVID patients, which is great news. For about 2 weeks, we probably were still hanging in that range where we call it the plateau, where we've seen the highest numbers for the past 4 months. And in about 5 days ago, the hospital started noticing a decrease in hospitalization, which it coincides with the information that it was shared in this town hall last week, that the numbers of COVID-related visits to the ED was decreasing as well. So now it's trickling into a lower acuity where people don't need to be hospitalized. And that is great news, and we hope that this continues. And this is a result of our community actually taking serious the precautions that need to be in place, wearing masks, social distancing, and etc. To continue to be prepared for any future issues or prepare for the long haul, we want to assure our community that at this point, and we've been at this point for probably a month and a half, that we feel that we have enough PPEs, enough equipment, ventilators, and we have everything in place so we can continue to provide the service and care for our community. But it is important for our community to also take some specific steps. One of them is, if you're planning to come to visit anybody at the hospital, we want to make sure that you are aware that you will be required to wear a mask. We're also asking, if you know that you've been tested and you're positive, please, you're not going to be allowed to come into the hospital. We had some occasions where we had to have a conversation and educate people from the community that they are not supposed to be out of their house, or even calling the hospital and asking, even if you have a positive test, to come and visit a loved one. We can arrange a virtual visit for your loved one. We just want to make sure that everybody stays safe, including our community. Along the same lines, in the emergency room, now we're asking visitors that are bringing a patient into the emergency room to actually wait in their car. And once that patient is actually placed in a room, we will call that patient and allow them to go in. And this is to prevent and to keep the safety, to prevent the spread of anything in the waiting area. We've been extremely busy. The hospital has been extremely busy. We ask the community not to delay their treatments. Please go see your doctor, urgent care, or the hospital. And because of that, we had to take some measures like this one in the emergency room to keep visitors in their car waiting for the patients to be put in the rooms, so we can have the waiting areas strictly for patients only. We want to make sure that everybody's aware of the new questions that we're asking for screening purposes. Some people are still surprised about the long list of symptoms that could be seen as related to COVID, like fatigue, nausea, and diarrhea. Those are the type of additional signs that the CDC actually added back in June. We want to make sure that, if you're feeling one of these symptoms, you seek medical care. But overall, we're doing okay, and we're doing fine, preparing for the long haul, like you said, and preparing for the winter, where flu season is around the corner, and we want to make sure that we're in a better place that we were back in March. I do want to share that Advent Health did a research in Central Florida. I wanted to share two findings from that research. So they did a survey with a number of community members across Central Florida, and 73% of our communities, and now I'm not saying just Flagler, across Central Florida, they feel that healthcare providers should help lead the conversation on how important it is to wear masks. And this platform that we have here today is extremely important for the community. So we can hear from our health department, from our medical directors, from the local hospital, from the fire department, the importance that it is to wear masks. And 63% believe that masks prevent spreading COVID-19. So we still have a large number, about 37%, who are either not sure or don't think that mask wearing makes a difference. But I want to point out that, Flagler County did well back in March and April, and we probably put our guards down a little bit, and we saw different numbers in July. And now we're seeing that it's improving again, and and we're happy to see a lot of people wearing masks, showing up to the hospital with wearing their own mask, and this is making a difference. So overall, I think we're doing good, and we hope that this trend continues as we continue to deal with this COVID through the end of the year.
Thank you, Wally. Wally raises an interesting point, because it's one of the questions, before we get to the Chief's long haul updates, one of the questions I think continues. I keep hearing it. I don't know that we've addressed it, head on, but to Wally's point, we're heading into the fall pretty quickly, quicker than I think any of us realize. And flu and COVID seem to have symptoms that are in commonality with each other. And so as we experience the beginning of flu season, I'll let you and Dr. Bickle start and Wally. One, the importance of flu shots and what you think about those. But how do we see, what are we preparing for when we prepare for the long haul? We have this conversation about that, what I foresee, what I think is logically an increased demand in services, as now I'm guessing, treating a lot of those initial flu symptoms like COVID symptoms until we know, correct? Is that?
Yeah, we are seeing a bit of a downward trend with COVID, as we said, but we're seeing a slight upward trend in flu-like symptoms in the emergency room. So I'm not sure if it's telling us that, the season has actually started. Usually that is definitely in the fall months, Matt. But we definitely have a very robust program of encouraging people to get their flu shots. We will be providing flu shots, the health department will, in our school system. We'll be doing that October, November timeframe. And one of our listeners to our virtual town hall said, hey, if you're going to be testing at these 6 places, and we probably will be throughout the fall months for COVID, and, why not use that as an opportunity to possibly provide the flu shot to those who are coming out to get tested for COVID. So whoever suggested that, great idea.
Good idea.
And that is something that we can definitely look into and investigate.
Did Dr. Bickle, did you have some thoughts as we approach flu season and preparing for the long haul?
Yeah, first let me speak to the influenza-like illness symptoms. There's minimal influenza right now. So that's just the overlap, that those symptoms are nonspecific, and they're probably, they can be from COVID, they can be from other things. So, but it's something we're definitely going to monitor. And in terms of the influenza this year, we really want to keep those influenza numbers down. It's going to just make the whole thing much messier if we get an influenza wave along with the COVID, confusing the two illnesses, increasing hospitalizations. It just could be, could be a perfect storm. So we're hoping for a very high vaccination rate this fall in preparation, to limit the influenza as much as possible. Also, mask wearing does help influenza, not necessarily as dramatically as COVID. So there's studies in, the Southern Hemisphere just went through their influenza season, or is kind of still in it. And also we went through it in the late winter this year, early spring, and the influenza numbers were generally somewhat down. I haven't seen the final statistics though. It's thought that the same social distancing and mask wearing practices help that. So what we're hoping is we have a very, very mild flu season this year, combined or as a result of social distancing and high rates of vaccination and mask wearing.
Great. Thank you so much for that information. Chief Forte, on our theme today of preparing for the long haul, kind of a status update and what we're doing as a fire department and as a city.
Good afternoon, everybody, and thanks again for allowing me to come. The department itself is looking at the long-term usage of personal protective equipment and having everything on hand, not so much for now, but in the future for future waves that come down the line. The staff is in good shape. They've gotten personal protective equipment squared away for the last 2 or 3 months. We're ordering more so that we're ready for the next wave down the road. But preparing the long cultural change for what we're about to get into is still weighing on a lot of people. And I think part of that cultural problem that we're seeing is those who wear the mask, those who don't wear the mask, and somewhere in the middle are the people that are at a crossroads. And I think I've got a question for the medical experts in the call. And if you would indulge me, the setup of it is kind of long, but there is a question at the end of it. And I've read some information that's coming out of Asia and Europe about the coronavirus itself and reemerging. And it's reemerging in Asia countries previously praised as models of containment, underscoring the resilience of the virus and dealing a blow to the idea of so-called travel bubbles. Hong Kong, Vietnam, Australia, Japan have all experienced great successes in the past on how to deal with this virus. Vietnam, for example, had 95 million people in the country and only 450 cases and 0 deaths up until about a couple of weeks ago when they started getting 100 cases a day. And now they're starting to come back up again. It's starting to spread rapidly again in Vietnam. Same thing with Hong Kong. They were experiencing a new wave of infections after not having reported any transmission for 3 weeks. Now they're also up to about 100 cases a day. Japan also reported high numbers of cases this past week, surpassing their 1,000 newly infections for the first time. And officials warn that another state emergency can be declared, and they may be shutting down parts of Tokyo. Australia had a surge and saw the deadliest day on Thursday, just last week, with 13 deaths and 700 more. And I think where we're going with this is this is just not in the United States. There's resurgence everywhere. And looking at the graphs, the numbers and statistics, it looks like we are still at the end of our first wave of COVID when we, in April and March, we flattened the curve. We were expecting hundreds of thousands of people to be contracting COVID. And at the time, we were able to lock it down and spread it out. And I think we're still in that first wave of COVID effect in the communities and in the country. But as a result of flattening the curve 3 to 4 months ago, we've learned a lot about reestablishing PPE and being better prepared for the next wave. This is kind of like that pebble in the pond, if you will, where each pebble generates a new wave, and each state, region, or country will see their weeks in the future where those areas are affected. Just kind of looking at, we've had successes in the last 3 months, but what are we expecting to see down the road in the next 3 months when we've reached that plateau where this is our constant normal? Because we've only affected about 13% of our whole national population. What are we going to see when we start seeing the second wave coming in and the third wave, and how we're going to address those general concerns?
Yeah, I
Bob?
think the public health measures are still going to be the same, just more robust and more compliance. You know, the facial coverings, the social distancing, avoiding large gatherings. I mean, a public health advisory by our Surgeon General, Dr. Scott Rifke, said we really shouldn't be having gatherings of more than 10 people. It's not 50 anymore. It's no more than 10. So it's these things that we're going to have to keep in mind, especially as the fall months approach with the flu season. And then as the weather gets a little cooler, people find themselves more indoors. And with the holidays, there's, of course, the usual routine of family gatherings and gatherings with friends and family. We're just going to have to do a lot of good messaging, effective messaging, to just make people aware of how the congregation of folks is not the right path to take when we're still dealing with the virus. And the more ability it has to spread when we are congregating indoors. So I think that's one of our main concerns. Dr. Bickle, do you have anything more to add to that?
Chief Forte, I think that was a great topic you raised, and it brings up something very important. Until we get herd immunity, and it's, we only want herd immunity from vaccines. We don't want it from people, that many people getting infected. Until we get herd immunity, there's no sort of inherent resistance of the population to this disease. So you can contain the spread for some time with extraordinary efforts, and then as soon as it gets an opening, if you let down your guard, it can spread very dramatically. I mean, look how rapidly it happened in Wuhan, and that was from just a handful of cases. Look how rapidly it happened, throughout the world. So that's just the nature of this beast. And I think what we need to get, in our heads is that this is not going away anytime soon. But we've got to live with it, and we've got to figure out how we can control it pretty well, better than we've controlled it so far, without paralyzing our economy. And it is a major challenge. I mean, there's no question that countries that have experience with SARS, the original SARS, and geared up their public health systems and their whole healthcare systems to fight, an emerging pandemic like this, are still struggling with it. But the thing you need to keep in mind is when they're talking about outbreaks, it's from a much lower level than we're talking about and than we're experiencing. So they have these pockets, and then they can kind of contain them. we have it so widespread right now and at such a high level. We're just trying to get it to a level where we can start to contain it. So there's a whole quantum level of improvement that we need before we're where these countries are, and hopefully we'll get there. And that's why we keep pounding the table on the masks and following these other practices, because that's really how that and contact tracing, which works best when the numbers are down, those are the tools that we have right now.
And if I can add, the importance of getting tested. Steve has mentioned it, and we've all been talking about it. The indicator, the positivity rate that we've mentioned being at the 7.3%, we truly want it to be below 3%, because what that tells us is that we are not catching enough of the spread of the virus out there in the community, meaning finding the individuals who are symptomatic and the ones who are especially asymptomatic and have the virus, because as Dr. Bickle mentioned, some studies show the actual case rate is 5 to 10 times more than we are reporting because of so many people that are asymptomatic. So testing, testing, testing. We need to get folks tested so that we can isolate those who are asymptomatic and symptomatic, and just, quarantine them so that we can protect the rest of us.
Yeah, for the hospital, we are approaching, that's a very good question as it relates to the long haul. For the hospital, our conversation internally is really expecting a second wave. We just don't know the impact of the second wave, and we're hoping that it's lesser than this first one. But we cannot keep our guards down, and we need to learn from our past and make sure that we're prepared in the future. And this could take much longer than we anticipate. The thing is, at what point you start letting your guard down and not taking the proper steps like we've been taking so far, and just get used to it, and then when we see it again, it's too late. So, the message from us from the hospital is that we continue to prepare ourselves for a second wave. We hope that it's less of an impact that we experience today, but we urge everybody not to let their guard down.
Your update was the form of a question?
Well, yeah, that was my update, is the form of a question, because we are fielding a lot of these, when are we going to be done with this question? Right. And I see a lot of the questions that we're picking up on the weekly updates are mask related, and there's people that are, I'm not wearing the mask, and then there's people that I'm not going into the store unless they wear the mask. So at some point we have got to change culture. And we're not going to infringe on anybody's inalienable rights, but we are also going to have to look at this as a very costly response to a pandemic, that if we don't cull the problem, it's going to just magnify. And I think before we get into the second wave, we still have to capture what we've done in the first wave as things that are working, and the masks are working. I've seen them out in the stores. They're getting a lot better. The aspect of people are staying further away is getting a lot better. But you still get about a 15% of the population that just won't do it. And that's fine until you get into somebody else's personal space. And that's where the frustrating part comes in. So, the update is we're seeing these calls. The fire department is responding to. Majority of the calls we go on are PPE recommended, which in April or March, we might have had 1 or 2 a day. And now I would say that we've got about 18 of those calls that we go on are PPE recommended, because we have identified a lot of folks in their homes, and the response that we're going on does take into account the people that have been affected by COVID. It is definitely not business as usual. And we are looking at it as self-survival when we're going on these calls and limiting our exposure as much as possible. I think a lot of the decisions that we made early on are working out now, because we've got a successful rate of employees that are still healthy. And there's areas that are both north and south of us that are having trouble making sure that the employees are on the trucks. But we're at a point now where if we're going to change the mindset of the culture, we've got to start getting into that mind frame of getting ready for this down the road. And what's October going to look like? What's January going to look like? Because I don't see it changing much from what the operation is today, except for opening ourselves up to a little bit more public access within controlled constraints. So I think that's where we're at with the fire department.
I appreciate that, and it's a great segue for me, as city manager. Again, from the beginning, what we've talked about is resource allocation, whether we're talking about hospital bed availability, we're talking about the number of first responders, we're talking about PPE, or how we achieve these downward trends. And we've been very pragmatic as well as trying to have as much normalcy as we can as a city government, access to our buildings, facilities, our operations. Captain Asconi, as we meet weekly in EOC, keeps pushing back and saying, as a frame of a comment he took last night, was the need versus the want. And he's saying we need to deliver services to our community, and we are. We're delivering his number keeps around 97%, and I'm going to take that as a good number because he's done a lot of work into looking at it. So the city continues to deliver almost 100% of its services, either remotely, through Palm Coast Connect, through our delivery platforms, through our public works, public utilities, and other crews. And so, planning as we go, we continue to think about the second wave. We continue to think about how those interactions and how we preserve those essential workers. Again, we go back to water and sewer, the essential nature of delivering those public services day in, day out, without disruption, without interruption or fail, how we continue to deliver services as far as our first responders, how we continue to deliver day-to-day services, whether it's neighborhood engagement through code, or whether it's parks and the virtual programming and all these important things that we've learned a lot about in the last couple months. As many people know, City Hall is remaining closed through the month of August. We're having very robust conversations about, for the long haul, again, how do we get those last couple of pieces like our planning and land use board and some other things transition to a remote platform. We're using case studies to look at that. We had some examples from some surrounding counties, and I believe it was Volusia County had a land use meeting. They had 1,400 people digitally participate, and so we're seeing not only these platforms effective and appropriate, but robust engagement. I think we're going to learn lessons here about staffing, community dialogue and engagement that are going to stick with us forever, about how they can be and should be effective, complements to our communication strategies, to our engagement strategies, and so we continue to learn those lessons. But along that line, we've got really two themes of questions here, and we'll get to a couple of questions. I don't want to not engage our residents that way today. A lot of questions around masks and theme, and we'll come back to those here in a minute. But Chief Forte, one of the big questions that we got several times was in relation to specifically Indian Trails Sports Complex and the possibility of tournaments coming in the fall for various sports. And how are we planning? What is our approach? And how are we being consistent in moving forward with the possibility of these groups coming and playing in Palm Coast?
That's a great question, and how we're doing this is not through a vacuum, but more along the lines of administering requirements for plan submittal on how these groups are going to come together and provide their sport event under a plan that's going to conform to what the recommendations are from the Department of Health and CDC. A lot of what we are looking at right now is successes that we've already had with the Flagler Sports Alliance, where they have provided us with plans. We've reviewed them. We've made recommendations on some. We're relying on the sponsors and the people that are incorporating these plans into their programs to enforce the rules. And as long as they're doing what the recommendations are, it's getting the students or the players out on the field and enjoying some quality time, getting some exercise in, blowing off some steam, and getting some fresh air. The same thing with these groups that are going to Indian Trails Sports Complex. They're submitting their plans. The Parks Department is doing a good job of reviewing them. They're working with Captain Asconi as our emergency manager to make sure that the plans adhere to this. And we're going to have folks that go out and just make sure that they're keeping track of what they're supposed to be doing. There is a fine edge on a two-edged sword, where if you limit the amount of people that go in places, you're going to reduce the COVID contagion. But also the other side of that sword is people got to get out and start doing stuff and living life. And if they are providing us with the necessary means on how they're going to do it, they should get out there and start experiencing some of those things if they're able to. We understand that when people are in lockdown or they're afraid and they see people out playing, well, they've also been vetted and described the way that they're going to protect the other members of the community as they're out there enjoying the environment. So, we do take some time, and we don't make these decisions in a vacuum. We look at the plans and we review them and approve them before they are allowed to come in and come in with their groups and play.
Thank you. Yeah, I would say the majority of the questions actually are dealing with masks and asking about, we had the great statistics. I appreciate Dr. Bickle always bringing relevant and current information to the conversation. 63% are using masks, believe they're working, and 37% fall somewhere between they're not going to do it or don't know about the efficacy or the value of wearing masks in the pandemic. But the theme of the questions is, how do we continue to increase mask wearing? How do we continue to have these conversations with our businesses about their workers wearing masks? One of the questions is, why don't city workers, the specific question is, why don't city workers wear masks? And so, I'll take a quick address and then others jump in. City workers are wearing masks. We're wearing masks in the building unless you're at your workstation, unless you're appropriately distanced. Or, sometimes out in the field, we have workers who are out distanced by themselves or, on a lawnmower. Even them, I'm witnessing most of them wearing masks all the time. Might be times where they, again, are by themselves in such a way that again, with the distance requirements and things, that they're not wearing a mask. They're not coming into contact for yards, if not hundreds of yards, with other people as they work in a ditch or on a lawnmower or have a visual need or whatever those things are. So, we're enforcing that. In fact, we started a few weeks ago and just had to get that strict and say, it is a requirement to wear a mask, and if you're not, then we're gonna send you home. We are committed. We believe as a city workforce that masks do work, and they are working. We value them, I think, as much for our own protection and safety. You've seen that new mask campaign. I wear a mask for my friends or my neighbors. I wear a mask for you, the community. So we believe it, and we're doing it. I know as far as businesses go, that Take the Pledge initiative continues to get stronger with businesses who are taking the pledge to have their employees wear masks, as their customers wear masks, to do all the distancing and sanitation. So, quickly, as we're beginning to run out of time, and I do want to leave time for closing thoughts, since so many of the questions are around masks and how we continue to increase that usage and drive home how valuable they are in this fight. Dr. Bickle and Bob Snyder.
Yeah, absolutely, Matt. Just a couple comments from me, and then I know Dr. Bickle's going to want to chime in too, and Wally. The studies, the science, the research shows unequivocally, the European studies, Asia, papers in the United States, that mask wearing is the most effective public health measure, in addition to social distancing, that we can take to prevent the spread of the virus. That is the truth. And that is the reality, and that's what the data tells us. And just the other comment, it's not just about protecting yourself, but wearing a mask is a sign that you love and care for all the people around you, your friends, your family, your neighbors, your coworkers, your colleagues. It's a sign that says, I care about you so much that I am going to wear this inexpensive, sometimes inconvenient device over my mouth and my nose to make sure that you do not get the virus from me or anyone else. That is what it says. And then regarding law enforcement, I understand the position of the sheriff and our police chiefs and police departments. They don't want to put themselves in being the mask police. Why? Because this is all about personal responsibility as a community to address and to stop the spread of the virus. That's the bottom line. Dr. B, Wally?
I think you said it very well. And I think, we Americans love and appreciate our freedoms. And, I think we all appreciate that. But there is an element of responsibility here to your fellow citizens, and I think we're just appealing to people, to their higher senses and their sense of responsibility, that this is a collective effort, and it's something that is an ongoing challenge. So we're just hoping that people will just adopt this on their own and they'll see the wisdom of it.
Yeah, from the hospital, we echo that. We strongly support any initiative to continue to wear a mask. And we ask the community not to delay any treatment related to their health. Make sure that they reach out to their physicians, the hospital, or even Centric Care. We want to make sure that you're being taken care of, and take the mask wearing serious, because it does make a difference.
Yeah, we continue to live in an unusual time right now. Things are changing, and I know change is difficult. It's scary in some ways. It's hard for everybody. It's hard for us. We're getting new information all the time. We're learning, but that's a key, I think, is being adaptive to that new information, and some new normal. Of all the things I'd never get, and I know our radio listeners can't see it, but I got this as a gift from my wife. Never thought I'd get a face mask as a gift. It's this great, incredible Hulk mask from Disney. But times are changing, and I thought it was funny that I have now a new accessory, right? An accessory to my wardrobe, to wear, and I think that's part of it. My kids want funny masks to wear as they have embraced the mask wearing, and so new normal, new conditions, and part of our initial discussion that Dr. Bickle led in with in his fifth bullet was hope. What's the hope, moving forward? And I think there is hope. I think these meetings demonstrate that as we get together. Continue to dialogue. So much appreciate the engagement as we continue to dialogue with the community, continue to share the best information. We don't know everything. I think all of us would admit that, but we're really trying to stay on top of it. I think we are as a group, as a community, staying on top of this as best as we can and working together as a community to find our direction and how we, navigate through this. Those will serve as my closing statements because we've got just a couple of minutes, and I want to give everyone an opportunity for closing thoughts and comments. Bob Snyder.
Yeah, Matt, I was reminded, along with Jonathan Lord and his team at Emergency Management and our team at the Health Department, that, we're in hurricane season. We dodged one, everyone knows, with the tropical storm, but we were prepared. And opening up shelters to the public and special needs shelters to the most vulnerable in our community is going to be a big challenge this hurricane season in the event that we need to do that. Trying to do this safely with COVID around us. But I want you all to know that we kind of tested the plan over the weekend, and it's going to work. We socially distance folks that we would evacuate to Rimfire Elementary or in other schools. And PPE and facial coverings definitely would be mandatory. But I just wanted to share, for those especially who are dependent upon power and electricity, for whether it is your CPAP or machine, or whether it is a concentrator for oxygen support, do make plans now. It is more important to shelter in place if you can, or to make arrangements to go and somewhere where there is going to be power in the event that we're hit here in Flagler Beach or in our coastal community. Make those arrangements now, because that is the most safest way to stay healthy while we're dealing with both hurricanes, sheltering, and COVID-19 at the same time.
Outstanding. I heard we had 155,000 masks distributed so far, 67,000 more now here. Where can people get those masks, those face coverings?
We're going to have points of distribution at the fire stations. We're going to hand out the boxes to each station, so you can go to your local fire station in Palm Coast. There'll probably be a container outside that you can grab 3 to 5 packets and take them as you need it. There's no guarantee that the firefighters are going to be in the building, so we're going to set it up in such a way that you can come grab a couple, and we're just going to monitor the outflow and make sure that there's plenty in the container. Please take what you need, but don't take more than what you need, because everybody's going to need them. But we'll have those out there probably on Monday for everybody in the community to go to the fire stations.
Fantastic.
Great.
Any other closing thoughts from any of our partners today? Dr. Bickle or Wally?
No,
Yes.
I think everybody covered
I
it.
set you up for that. That was my fault. Dr. Bickle, sorry about that.
No, I think Bob Snyder said what I wanted to say.
Awesome. And Wally?
Yeah, I like to end by thanking all of the staff at the local hospital. They've been working hard for since March, and everybody with the little army that Bob Snyder has at the health department too, working hard, and all the other healthcare providers in our community, including our first responders. We're very thankful, and I ask the community to recognize that whenever you see them. They've been working long hours throughout this pandemic and putting their lives in the line. And we're very thankful for everybody that we have here in our community.
I just would echo that as well as we close out today. Just a big thanks to all of our workers, whether it's here at the city, we have folks that go out every day in every weather condition and continue to keep our streets clean and patched, our right-of-ways maintained and mowed and trees trimmed back, to our water and sewer folks, our fire department, all through the administrative ranks, and our customer service, and just the tremendous commitment they continue to make to prioritize the community over themselves. Very grateful for that. And of course, wouldn't be here today without the strong, consistent leadership of our city council and our mayor, Melissa Holland, Bob Cuff, our Nick Klufus, and Eddie Branquinho, and of course now John Netz on council. So just grateful for their continued leadership as we move through the rest of this. And more importantly, thank you to all of you who have tuned in today, who are going to watch this or listen to it later. We very much appreciate, I know the council and the mayor value the continued dialogue and the engagement with the community and the partners, and we look forward to seeing you all again. So thank you for making time to be with us today.